What's up, guys? All right, guys. So let's talk about anxiety and talking to doctors. So this is going to be a short video, I promise. So let's talk about anxiety. So anxiety as a new nurse is going to happen. You're new, you don't know what you're doing. That's why I tell the nurses that are new coming after me now on my job that you have to ask all the questions that you can possibly ask, and also make up some questions, make up some just in case questions or what if questions, because what's going to help your anxiety is knowledge. You have to know what to do. You have to be prepared. I'm telling you, you have to get your report sheet, get your whole system down. There's a whole system that you're going to have down packed. You're going to have a routine that you follow that's foolproof, and it gets you all the information that you need, like how you look up your patients, what you look up, what kind of information you take during report, the questions that you ask during report, and all of that. You have to, and that's gonna come. You know how many times I had to change my report sheet and add and take away and reconfigure and all of that. All of that is gonna take time, but you have to know what information you need so that you can operate and do your job during your shift. And if anything was to happen early in the shift, you have all the information that you need to give to the doctors and to give to the all those that are coming. If you have a code or a rapid or whatever, you have to know the basics, allergies, what was the last medication that they took and all of that. And if you don't even know all of that stuff, at least know that you have to have the chart pulled up somewhere if anything was to happen. Okay, so knowing what to do and being properly prepared is going to kill a lot of that anxiety. Coming on as a new nurse, I can't really say I had a lot of anxiety. Was there some fear there? Yes, there was some fear. I'll go somewhere and pray. And that fear was mostly coming from, oh my God, it's real now. Or it was, a funk is hitting the fan now. It's just me. I'm on my own. I really didn't have an anxiety when I was precepting because I was with someone, and it felt like I didn't have any really responsibility. But when I was on my own and started to become on my own, I started to feel a way, and I would just say, you know what? I got to talk to myself, encourage myself. I got this. I asked all my questions. These are the same disease processes that I've been dealing with. And that's another thing you have to know as a new nurse when you're on your floor, to kill some of that anxiety. You know the disease processes. You know the kind of stuff that you're going to normally see on your floor. That's why it's important that you study those things. Once you have a person that had a breathing problem, look at those medications, or say, go back and reflect, okay, what did I do during this shift? Or what did me and my preceptor do during this shift? How did we alleviate the problem that the patient was having when they were, going through, their, whatever episode they were going through, respiratory wise or cardiac wise, or, when they were having pain? What did we do? What non-pharmacological thing we did, and what did we do? What kind of medications we gave them? Make them your case study. This is going to help you, because you're going to have a patient just like that another time, even maybe your next shift. So I learned that the same patients, they all have the same disease processes, because I'm on a cardiac PCU floor, and we get a lot of respiratory, a lot of cardiac. And it's the same situations that I say over and over and over again. So that helped prepare me and to give me some experience on what to do. If I can't do anything for them respiratory wise, call respiratory and stay with your patient until they get there. What else can you have to understand that you are not God. You can't fix everything. You're not. So you have to know your limits and understand what you can do and what you can't do, and just take it from there. And also, you have to have a calm attitude. Be calm. Don't be one of those people. When I was precepted, I told my charge nurse that does all of that. I was like, you know what? please put me with someone that's calm, because I can't have, people that's like really high strung and intense during the beginning of the shift and it's just all over the place. I can't be with a person who's all over the place. I can't be with a high strung and intense person because I don't work well with people like that. I'm a very calm person, and I'm just very calm. Even in stressful situations, I'm calm. I had a cold the first week on my own. I had a cold blue, and everyone kept coming to me. I applaud you on how calm you was. That's just me, and I make sure I'm like that because of experience and life experience. This is why I'm calm. Is because it doesn't pay to be all antsy and to be high strung. That just makes the situation worse. And I'm older than a lot of these people. Even though I'm a new nurse, I'm older in age and I've lived. So I know how to deal with certain situations pertaining to life, basically. You just get older and you just figure out, it's not worth it. We don't need to do all of that. It don't take all of that. So I'm a very calm person, and I just can't. So stay calm and try to stay calm. If you're not, that's something you got to work on. But yeah, you have to come in knowing that you were trained for this. Also know that you are not by yourself. You are not alone. You're not coming to work and you're the only team member there taking care of the patients. You have a whole team of people with you, backing you and behind you. So don't come in thinking that you're working by yourself. That's another thing that's going to alleviate your issue now. If you are in an environment, this is one of the environments that working in a hospital as a CNA, my first hospital job was an environment where no one helped. It was mean girl high school environment with the nurses and even the CNAs. So that was all I knew for like a long time because I was working there. I didn't know there was any other way. So that right there, coupled with the patient load and other factors pertaining to how the hospital operates. There was a lot of turnover at that hospital. There were new nurses here today, they were gone tomorrow. I mean, ridiculous. People quitting left and right because it was just ridiculous. A lot of people say, you know what, this is not worth it, I'm out. And they'll go find another job, nurses I'm talking about, somewhere else. This is what I've seen as a nurse. This is one of the reasons why it took me so long to become a nurse, because seeing that and a lot of people crying in the corner and crying at the elevator, crying on their way home, crying on their break, everybody crying. It was like, I don't think I want to become a nurse if everybody crying. I don't want to be sitting up there crying every 5 minutes. And that's what kind of deterred me, because I started taking prerequisites in 2009. And I got my nursing license in 2020. Okay, prerequisites done by 2000, started in 2009, by 2011, prerequisites done, and I just stopped. I was like, after what I was seeing, I was like, no. So I continued to be a CNA. Then it got to the point where, okay, now I need to do something else. So yes, guys, it has a lot to do with the environment that you're working in. And if you're working in an environment that I came from, an environment that's mean girl high school all over again and no one helps and it's just rough, that's the environment, and that's probably a sign that you have to just get up on and find another different place to work, because that's not going to change. It could just be that and not the patients, but when you have that plus the patients and plus being new and plus not knowing what to do with it, no one is helping you, all of that together causes a lot of stress and anxiety, and I understand why people are very anxious and have to get Xanax out. That's not healthy and that's not good. So if you find yourself in a situation like that, your best bet is just to probably find another job. There are good places to work out there. Let's talk about doctors and calling doctors. So calling doctors is something that you're going to have to do. I'm telling you, as a new nurse, when you're precepting, you want to take the initiative and with the help of your preceptor, start calling doctors early and getting comfortable talking to them. They're people too. Okay, guys, they are people too. Just know when you call them, you make sure you have all your ducks in a row. Call them for the right reasons. Make sure you're calling the right doctor. Make sure you have all the necessary information that they will need in order to make an informed decision, and know where to look. Have the chart already pulled up. Anticipate their call, because what they want you to do is give them the information quick, fast, in a hurry. I don't want to be on the phone with you for 20 minutes and you sitting there explaining all this stuff. Tell them short and sweet, especially when you're texting doctors, short and sweet. Don't be like, oh, let me tell you something. When I started texting like the hospitalist and I was like putting a lot of highs and thank yous and all of that stuff, they was like, stop texting them back. After they give you the order, that's it. Don't say thank you. Don't do anything, because that's another text that they have to now pick up their phone and read and disrupt them from doing whatever it is that they're doing. And it makes a lot of sense. I was like, all right. They said just get short to the sweet, patient, complaining of such and such, heart rate, temp, blah, blah, blah. Give it to them short and sweet, that's it. Don't give them a long dissertation, because that's what I was doing. And she was like, no. So before you text the doctor, before you call, okay, let's talk about text. Before you text the doctor, write your text out and go show it to somebody. Here, this is what I wrote. And then they'll tweak it for you. Get rid of this entire paragraph and just put these three. Before you call, say, this is the problem. Am I supposed to call this doctor? Because you'll see patients have like 20 doctors. Am I supposed to call this one? Information. What information am I supposed to give them? This information. Have everything written out. And if you are so afraid of speaking to them, have a script written out. Everything. Hi, my name is Sonia or Sylvia or whatever. I'm the RN for this person. Have a script written out so that you just read it off your paper, and that's that. Everything is there so that you won't forget. Especially sometimes I notice I used to forget a lot, because doctors, they probably forget too, I don't know, but they don't give you the whole prescription for the order. They'll leave out certain things like milligrams or the route or something like that. You want to get all of them. So have them written down and write what they say underneath them and read it back and make sure everything is covered, so that you don't have to call the doctor again just to get that little piece of information, because then you look incompetent on your part because you should have asked. But we're so nervous that we forget, So that's why write it out. And the more you do it, the more comfortable you'll become with it. And then you won't even need your script. You'll already know what to ask for. You already can hear. And when you have missing information because of experience. Right now, you don't have any experience. So you better write that sucker down. Okay? It's going to help you. Write your script out. Double check with other people, a charge nurse or someone you trust and is really good at their job. Because sometimes a charge nurse don't know what they're doing either. Especially if you come from a facility where I came from before, you can be a new nurse in 3 months, you're a charge nurse. All right? So make sure you go to the right people who know what they're doing and people that you trust. What else? I think that's it, guys. Yeah, just know that these doctors, don't be afraid to talk to them. They know it's their job. They know you're supposed to call them when you have a critical value or for other things. They know, just have that mentality. This is your job, and you know that I'm supposed to call you with this, and it's not new, okay? And if they try to get snippy with you, there's ways to deal with that too. Don't let them intimidate you, because some of them will. They will try you, especially if you're new and they know that you're new. Some people are like that, because they have insecurities of their own. and they feel that they need to do that to make themselves feel better. But, you know, just give them what they need to know and do your part and chart. And if they don't get back to you, then you do what you need to do. Go up the chain of command if it's necessary, all right? Or just document it and you do your part. But don't be afraid, because this is what you have to do, and they know this is what you have to do. So don't make it seem like this is not something that you have to do. Once you have it in your mind that this is their job, they know it's their job, that alleviates some of that fear of calling the doctor, okay? Because a lot of them, you'll be surprised, they want you to call, all right? And it's about the patient. It's not about you and your feelings. It's not personal, guys. It's professional. Always remember that. Okay, you're there to do a job, just do it. They're there to do their job, they need to do it. All right, guys, so with that, talk to you guys later. Thanks for watching. Bye.